Good afternoon, everybody. Wait a minute here for everybody to get in. Looks like we have a few of you here. We had quite a few registered, so I don't know if they'll be joining a little late or not, but I want to be prompt and respectful of your time. So we're going to start right out at 1 o'clock here. First of all, I want to introduce myself. My name is Michelle Beebe, and I am the Chief Revenue Officer for the Small Business Association of Michigan. And I have a couple of teammates here with me that are going to be manning the Q&A. So as we go through the presentation, if you have questions, I'm going to do my very best because this is my third or fourth one at this point that I'm getting. Either we've taken care of a lot of the common questions, or I try to get ahead of that as much as I can in my presentations to make sure that we're covering all of the valuable things here. But I want to introduce Kevin Concannon. He is the manager of the SBAM's member care team, and we have a dedicated member care team for Nurture Benefits. And one of those members of those teams is Brianna Schumann. She is also here and will be doing a lot of the loading some things into the Q&A and links for you to have access to as we go through the presentation. So please feel free from a taking care of business opportunity that you can leave questions throughout the chat. They may not answer them right out of the gate, knowing that I'm probably going to cover it maybe a little bit later in the presentation. But we will do our level best to make sure that we're answering everyone's questions and that we are, and there, I got stumped on the last one. So sometimes you have a question that I may not know the answer to. So with that, let's get started. One of the things that I want to make sure that it's clear is there's some kind of, I want to make sure that there's a clear understanding of what and who Nurture Benefits is and what its connection is to the Small Business Association of Michigan. So Nurture Benefits is actually a multiple employer welfare arrangement. And that is going to be affectionately called throughout the rest of this presentation a MIWA. And what this does is it provides a unique way for employers, multiple employers, but all in the same industry, to be treated as one large group and have all of your employees pooled together. And what transpired was, I guess it's almost been a year and a half, almost 2 years, that I had a conversation with Emily Laidlaw at MyLeap to talk about if they were going to apply for a grant. Is there a way that we could help administer and set up a pooled employee benefit program for child care providers? And so I said yes, and we put in a proposal to the federal government, and part of that proposal with the PGG 5 grant funding from the federal government had a portion of it that was set aside for a 2-year pilot. And the pilot is designed to allow for Michigan's licensed and license exempt. So those are two key things that you need to remember through this conversation: child care providers to access affordable employee benefits, including health, dental, vision, life, disability, and retirement plans. Nurture Benefits is also a separate business. It's an actual business entity, and it's an LLC that is a subsidiary of the Small Business Association of Michigan. And it's separate. It doesn't have membership requirements. It is set up specifically to do the governance of this MIWA. And it's governed by a board of child care providers and a member of SBAM, which is me. Why does this program matter? When we started to do some research and get some details from MyLeap as well as our own survey data, what was determined is about only 35% of the employees staffed through a child care center, family home, or group home receive their benefits through their employer. And through that surveying, we realized that and none of this is a surprise to you guys, right? Like you live this every day. a lot of your challenges on being able to offer coverage to your employees is financial burdens. You have slim profit margins. You have lack of affordable benefits in general. The benefits are very expensive. Workforce shortages and wage disparities within your workforce, administrative and regulatory complexities. So you have a highly regulated industry, and a lot of your time and resources has to go into those places. And then actually being able to compete for talent. So there's a high turnover within your employee base, and being able to help with retention and strengthen that employer-employee relationship was really important to us when we were building this program. And again, I just wanted to give you a little bit of history, and if you're not familiar with who we are and what we do at the Small Business Association of Michigan, I just want to let you know that we're not a fly-by-night association, that we weren't just created overnight, there was a particular reason why MyLeap came to us. So we're a 50 plus year old association. We were actually established in 1969, so 56 years old, and we've had a lot of alliterations about who we are and what we do, but we've always kept our mission very simple. Our goal is, and our mission of our organization is the success of Michigan small business owners, period. Everything that we do, every decision that is made, we're governed by small business owners. And so all of our decisions are driven in that mission. We also have another subsidiary within our organization called the Small Business Insurance Services. And that team, which is both Brianna and Kevin are members of, is their specialists. You've got licensed insurance agents, you've got people that know how to do COBRA administration, compliance. And so that is why this really how the conversation started is that we do have a reputation in the market to be able to offer large benefits to a large group of employers, and we have the talent on staff to support that. And so that is why MyLeap came to us in the first place, is because we already have an established reputation with carriers, with knowing the compliance pieces of it. We have a unique consolidated billing aspect that will allow for us to be able to handle subsidy billing and being able to bill employers with that subsidy in there. And so we kind of had some special sauce that made us very attractive in that conversation with the state of Michigan. And then, as I mentioned, MyLeap was actually awarded a large grant from the state of Michigan, and a portion of that was part of the contract that they have with SBAM to help the childcare sector more attractive for talent and promote worker retention. These funds are being used to create a benefit platform for childcare providers and subsidize insurance premiums. This aims to improve access to affordable employee benefits for childcare providers across Michigan. So that's been the mission of this from the very beginning, that to provide a stable workforce to allow you to compete for talent. And we all know that when you are stable, so are our kids, in that getting access and having more kids in care is certainly the mission for the state of Michigan. Our governance structure, so again, Nurture Benefits has a board, and a board made up of 6 child care providers. That board has been selected based on their unique demographics, where they're located, what type of industry or type of center that they are, and or provider, and making sure that we had a well-rounded representation of rural and inner city and different needs, so that when we were talking about making decisions on your behalf, they were not made by SBAM, they were not made in a vacuum, but they were made by your peers. And then one SBAM member, that's me, and really my job is to make sure that we're following all of the rules that are required to have an established MIWA, that we're doing all of the appropriate reporting, and that I'm doing the work that based on the decisions that have been made by the board. The process that we went through, we sent out, back in February, an RFP to multiple carriers within the state of Michigan and national carriers to allow them to bid on us doing a MIWA for childcare providers in the state of Michigan. And some of the key things that mattered was one, that they had the capacity to handle a large account. Two, that they were allowed to be able to offer benefits statewide and that there was a provider network statewide. When I say provider in this space, I'm talking about doctors. And making sure that we had a comprehensive benefit for preventative care. And with that process, we landed on the best solution was with Blue Cross and Blue Shield of Michigan and Blue Care Network. And actually, the benefits that we've selected are through the Blue Care Network side of the Blue Cross family. And we'll talk more as the presentation goes on what the benefits are and how much they cost. And why a MIWA? So they're really what we wanted to be able to do is to allow all of you to be looked at by the carrier as one large employer, and that's what happens. So Nurture Benefits is technically the employer with the state of Michigan. The MIWA is the employer, and all of you fall underneath that umbrella. You have to be able to meet the eligibility requirements, which we'll talk about in the next section here, in order to be eligible to offer benefits through the MIWA. But in all intents and purposes, if you called Blue Cross or Blue Care Network and asked about your benefits, you would be asking for your benefits under Nurture Benefits, not underneath your employer benefit. And this allows for you to have the same pooling and competitive advantages of like the state of Michigan and their large pool, teachers and the manufacturing, auto manufacturers and some of the larger businesses. So it allows for us over a long period of time to build up our own pool and claims experience to negotiate rates, which in the today's standard, if you were going to get health benefits today, that's just not possible doing it on your own. And then eligibility and access. So these are important dates. I'll reiterate them a couple of times, but when we launch and officially launch for you to have access to benefits, that pilot is going to launch on November 15th. That is when you can actually sign up for insurance and get your application in. And it doesn't mean that that's the only time that you can do this. You can enroll throughout the year. But November 15th is going to be the first one that's open for you to be able to enroll for a January 1 effective date. But let's say you have you renew in June. There is no reason why you can't renew and move into the program in June instead of January 1 based on how you currently offer benefits. You also can, and if you are a June renewal, you can also move for a January 1 effective date. One of the things about this program is the rates are guaranteed for 12 months. So anytime that you enroll, if you enroll in June, those rates are only going to be good for 6 months, and then there will be a rate change effective in January of 2027. But I want to make sure that everybody understands that no matter what time of year that they enroll, the rates are going to be the exact same that we discussed today. Benefit eligibility. So this is who's eligible to enroll in Nurture Benefits. You again have to be an actively licensed or license exempt child care provider in the state of Michigan. And your headquarters has to be here in the state of Michigan. We're going to validate that information when you send in your attestation to enroll. So we will be asking for your active license. We will make sure with the state's licensing department that you are in good standing. And we're going to be doing some checks with Dun & Bradstreet to make sure that you're a viable business before we move forward. Your employees working 30 or more hours are eligible for benefits. So anybody that, and you may say, okay, well, I've got some seasonal, I've got some different types of employers or employees. So really how we establish who's eligible for benefits is that they have to work 30 plus hours a week for an average of 9 months out of the year to be eligible for benefits. And any of your new hires will be eligible for benefits 60 days from employment. So they will, on that 61st day, be eligible for benefits. Again, regardless of your size, you're eligible. So if you're a sole entrepreneur and you're a family home run childcare provider, you are access for benefits for the same exact benefits that you can get if you were a center-based or a group home. So down to 1 in size. Again, dependents are eligible through the calendar year of their 26th birthday. So just pointing out, some of you may have children that are in college And that 19 to 26-year-old, sometimes they're not eligible for benefits depending on how the plan is designed. In this particular case, children between the ages of 19 and 26 will be eligible. We also made eligibility for domestic partners in for benefits as well. So it allows for, if you aren't married, and there's some criteria to be eligible as a domestic partner, but if you, it could be same sex or different sex marriages or non-marriages that would be eligible for the domestic partner rider and be eligible for benefits on this plan. Subsidy eligibility. Probably this is what you guys are all here for. You want to know how this works, how the plan is designed, and who is going to be eligible for subsidy. So subsidy eligibility, there is some limitations on how many people are eligible for the subsidy. I know that we're working with the state of Michigan and even the governor's office to see what we can do to raise the numbers of who and how many can be eligible for subsidy. But as of today, there was $1.8 million, which sounds like a ton, right? But unfortunately, it only gets spread out so far. And so there's $1.8 million set aside specifically for subsidy. And that eligibility is going to be based on how you complete an attestation form, and I'm going to talk through what that looks like. So the employer needs to complete the attestation form on November 15th. And it's going to have a weighted lottery system. Providers receive points based on how they respond. Questions are weighted to enter the lottery. Higher scores have more entries into the lottery. So everybody gets in the lottery. It doesn't matter how you answer the questions. Everyone's in the lottery. But depending on what your truth is when you fill out your attestation form, you may have more than one entry into that lottery, and just increases your random selection on being chosen for the subsidy. Want to make sure that you also know that what is weighted in this process as well is making sure that we have an even distribution within the state. We're a big state. We have a lot of childcare providers, whether it's rural, inner city, or the UP, which is a combination of both, making sure that we have good distribution within the state of Michigan. So the employer health, this is an employer health program. So I want to make sure you also understand that. So was, I think, a little misconception in the beginning that you can just send your employees here and they can figure this out. No, as an employer, you have to make a decision that this is something that you want to offer to your employees. This is an employer program, and the employer needs to make the decisions on what plans are being decided, filling out the attestation form, and then deciding if you want to move forward or not. And then you also, as an employer, have an additional opportunity, if you are subsidy eligible, that you might also be able to add an additional contribution. So you have those two options. It's not mandatory, but you do have some options to be able to offer benefits, additional contribution to the benefits. As I mentioned, we have $1.8 million, and what that translates into, and this was a board decision. So I want you to know that the state of Michigan didn't make this decision, or Michelle Beebe didn't make this decision. Child care providers, and it was presented to the child care providers that we would have, we approved 50% of the base premium of the PCP Focus Network benefit and we'll talk a little more about what that benefit is. So 50% of that. So it translates into, and I have here 50% is a single of the health and prescription rate of $291.33 per month per employee. Single dental rates, you can choose $16.20 per month per employee. And then the vision rates are very cheap. They're only $5 a month per employee per month. And so wanted to break it down so you knew what that 50% translates into as a dollar amount. And what that allows for is if everybody that is subsidy eligible picks all 3 lines of coverage at that base premium level, means that we can cover up to 484 employees. So I know it doesn't sound like a lot. Trust me, we wish that the rates were lower than what they are. But Blue Care Network was the most competitive when it came back in when we got RFPs from other carriers, and one of the only that could cover the whole state of Michigan, which was also very important. And so just so you guys kind of understand how the rates were determined is we don't have anybody enrolled today. So they have to do their best guess based on what we know and how many people are eligible, who might enroll, who might not enroll, and what the risk pool might look like. So they're doing the rates are based on a best guess. If you went to Blue Cross or Blue Care Network today, you could give them your census and you may have a different set of rates because it's rated, you're rated based on your exact census. In this particular case, we're gonna do our best guess based on who's enrolling. And so I know there was a lot of questions about like, wow, that's really expensive. Well, it is in reality, but we've got actually a really great deal and a carrier that wants to partner with us because they believe in the mission and the cause to work with us through this process. So my hope is that we build a big enough pool, have enough childcare providers in it that we can really negotiate our rates next year, and we're building a really something solvent that long term, instead of trending more up, we're trending down in rates. And that's the advantage of all of us working together in a big pool. So as I mentioned, you're going to, in order to be eligible for the subsidy, you're going to need to fill out a subsidy application. This will be a live form that will be on our service portal and on our website. And Brianna is going to be great and put those links into this conversation. I'm also going to have them in the presentation. And I should have told you in the beginning, this presentation is obviously being recorded, but we will send you at the end, um, most likely this afternoon, we will send you a copy of the presentation. So the slide deck you have, that's yours. And we will send you the live presentation. So if you want to share it or listen to this again, you will have that as well. The subsidy application includes a lot of just demographic information, your name, email, phone number. If you're not the owner that's filling out this, are you a decision maker that can complete this information, your name, your title, and your information, the business's name, federal ID number, and your license number. Some of you that are sole proprietors, you may file a Schedule C and do not have a federal ID number. That's fine. We would just need your social security number at that point because that's going to be your unique identifier once the applications are approved. Your county, as I mentioned, we're going to be paying certain amount of attention to distribution and location. And then important things like the number of hours, number of employees, because we want to make sure that we're setting aside, if you get approved for subsidy, we're setting aside enough money in the pool for all of your employees are eligible. It doesn't mean they're all going to take coverage, but we want to make sure that when we do approve you, that enough funds are going to be set aside for everybody that's eligible. And then how many are working less than 30 hours? This is also important for us to know what the risk pool is moving forward and know what that information is. Health coverage status. This information is very important. Do you offer coverage today? Offer coverage, but you do not contribute to it. So meaning you do have group coverage, but you're not putting an employer contribution there. You offer and contribute to a group health plan. And if you do happen to do the last two, then we'd like to know the name of your carrier. And then also share if you're offering benefits, if you're offering it to all of your employees, are you going to maybe offer it to your lead teachers and segment out the rest, or any kind of different demographics you might be have with your particular um business, and anything that you might be breaking out separately. This is going to be an attestation that you're you know setting this up as a valid, so there's going to be electronic signature and date, and then we're also going to need a copy of your most current census. And that information is going to be necessary for us to, again, to validate, to make sure that we are setting aside the right amount of subsidy dollars for you and your employees. At a high level here, this is the benefits, and you can see the detailed benefits at a glance on our site. So if you want to know more information about like what's covered under the deductible and what's covered at 100%, any of those kinds of things, we have the very detailed, they're called benefits at a glance on our site that you can get into. But at a high level, these are the three plans that are being offered. Again, they're all Blue Care Network benefits, and the base premium is an HSA high deductible plan. I'm sure all of you are familiar with that, and it has a high deductible of a $63.50 per member or $12,700 per family or a two-person in the calendar year. It has no, once deductible is met, there's no fixed dollar copays or coinsurance. Everything's paid at 100%. And then I think an important thing to note is that preventative services are not subject to deductible and coinsurance, that those are paid at 100% right out of the gate. And then this does have prescription benefits, and those are covered at 100% after deductible. Also, to understand that we have a medium plan. These are more of a traditional HMO setting. They're not a high deductible plan. You have fixed dollar copays for when you go to the doctors. And here in this section, you can see what those fixed dollar copays are for office visits, urgent care, emergency room, referral to a specialist, or for high-tech imaging, which would be like an MRI or a CAT scan. In this particular case, there would be a 50% coinsurance for select or a 20% for select services. And again, that benefits at a glance is going to be your master document for you to go in and check which benefits fall into that category. Again, preventative services are covered 100% in all of the plans. And then all of them have prescription benefits, but some of them are set up a little bit differently. But so obviously base is going to be the least expensive, mid is just that, it's in the middle, and high premium is going to be, it's a richer benefit. And obviously you can see we go from a $4,000 deductible to a $1,500 deductible. So there's an adjustment in rates based on less deductible to satisfy. Also, we felt it was really important. We got a lot of feedback in the surveys that how important it would be for you to have access to dental and vision rates. A lot of you don't have that today. And and again, you don't have to take dental and vision, or you could just offer dental and vision. So you can mix and match depending on what works best for you as an employer. So you will need to let us know that when in time of enrollment, which way you decide to go. But as you can see here, 100% on class one benefits. Class one benefits are traditionally those preventative, getting a cleaning and that anything that takes place during a cleaning. Class two has a very low deductible of $50 per member or 150 for a family per calendar year, and then it's 50% of the approved amount after the deductible, and that's going to be your x-rays, fillings, those types of things in the class two space. In class three, again, there's the deductible paid at a 50%, and class three is typically your bridges, crowns, dentures, those types of things in that category. And then VSP vision. So this is, again, it's attached to the BCN benefit, but this is the largest network in the country is VSP vision. I think you would be hard pressed not to find a doctor that doesn't take VSP. It's a 12-month benefit, so you have this allowance adjusts every 12 months. And you have an $10 eye exam for coverage, $25 copay for glasses and lenses, and a $25 copay for medically necessary contact lenses. This is, again, a high level. We have, we can give you more details should you need it, but this really kind of takes care of what you need on the rates. So the rates that we discussed earlier that were 50%, it was the PCP focus here in this very first line as a single. So we are going to pay, and this includes the prescription on all of these single, two-person, and families. This is 50% of the base premium. If you choose to upgrade to a mid or high premium, as you can see here, these are the rates and the options, you're still going to get 50% of this amount. So we're still going to contribute that, what was it, 293 or something like that, that's on the single rate, that will work. That 293 is still going to get applied if you do either of these plans. But you or the employee will be responsible for the difference. As you can see here are the base, here's the rates. They're very straightforward for dental and vision, $32.41 a month per single, and $5.01 for a single on the vision side. I do want to share with you more information. We have a partner on, I don't know how many of you offer life benefits, but we do have a partnership with One America Financial that is going to offer life benefits. And we have term life for 10,000, 20,000, and 50,000 increments. Your AD&D will match the life benefit, and this is guaranteed issue coverage. Rates are guaranteed for 2 years, so rates are not going to change. And it does require 100% contribution and participation. There's some eligibility rules here on family, like they have some requirements that if the family is less than 2 to 9 eligible, if it's a family-owned business, they will not insure if the family consists of 50% or more of the enrollment. And then on 10 or more size groups, they will not insure if the family content exceeds 30% or higher. Here's the rate for the standard rates. As you can see, this is age rated. And this is for the group AD&D coverage. We also have a pooled retirement 401k program. And this has been surprisingly one of the most attractive things that most of you have already started to take advantage of. So you don't have to wait if you're interested on getting more information on the retirement benefits. You can reach out to the team, and we'll talk a little bit more about how you do that. But there was a lot of desired interest in offering the 401k. You do not have to do a match as an employer. It does allow for small group enrollment. So it is also a pooled plan, like the group on the health side. All of us are in one large pool. SBAM happens to participate as well, so we're all in there as well. And the more we have in there that's participating, the better the performance of the return on the investments that we're making. So like, as I said, it treats it as a large plan. It's sponsored by, it includes independent fiduciary oversight by pooled plan provider. So we have a partnership with Transamerica. So Transamerica is the insured for the 401k. They're the fiduciary behind the scenes that are taking care of the investments. We partner with Greystone Consulting that does all of the financial advising. So all of your employees can meet with a financial advisor to decide what's the best way to invest their money. And as can you. And then the pooled plan provider also manages the administration and the oversight. So you don't have to deal with any of that. And you also, if the pool pays for one plan form of 5,500 and one single audit. So you don't have to pay for any of those things. There are some of us that are larger in size that do have to have a 5,500, but you will get that at a much cheaper price than if you had to do this if you were in a standalone plan. So things that you need to be aware of, these are important things. I'd love for you to go out today and create your online account at our mi.freshdesk.com. This is our service portal. This allows for you to get set up on the service portal. There, create tickets if you need to communicate with a member of the team. It's really easy to do this at the service portal. It's live 24/7. We're not going to be available 24/7, but we will get back to you as soon as possible. And I know a lot of you, because you're the chief officer, HR, all of those things in your business, that you have sometimes you're doing these types of things in the evening. Go ahead and send your questions in the evening, and we'll get back with you first thing in the morning. Again, please remember that November 15th or later to complete your employer attestation form. It will be live on our website, and you will have access to that. Nurture Care staff, as I said, we have a dedicated staff hired just for you, trained on your benefits to answer your questions. They are also licensed insurance agents. So if you need to talk through what's the best plan design for my team, how should I, go about picking what benefits or how I should contribute, they're there to help you through that process. There will be additional enrollment paperwork if you decide to move forward. We also will have a benefit portal for you that allows for you to go in, select your benefits online, also for you to set up employer contribution. And it has reporting for payroll purposes. So if you do employee deductions, you can do, it'll have a report for you from a payroll perspective and integration to lots of different payroll vendors, should you have a vendor that you're using today. Employee elections. So all of your employees, once you set yourself up in the portal, and we're going to walk you through that, we're going to have a team member that sends you the link, gets your benefits set up, and then you just need to set up your employer contribution. And then we send an invite to all of your employees. They go in and decide whether they want to enroll or if they want to waive coverage. A big portion, a big, not a big portion, a big thing that I want to point out is because we are one large group, we are subject to ERISA requirements, which means that you all become ERISA eligible and you will have to offer COBRA to your employees. We have a dedicated team here that is experts at COBRA. We've been doing COBRA for years. We know how to take care of it. All you'll have to do is fill out the paperwork, and behind the scenes, we'll take care of all of the notifications, the appropriate billing to the employee that is eligible for COBRA. And if you have any questions about COBRA eligibility, we've got the experts here to help you. And then how is, again, I talked about we're licensed agents. One of the other things that are required is summary plan descriptions. We'll take care of that compliant feature for you and get those to you and to your employees. And I talked about the portal, but we also have a dedicated phone line for Nurture Benefits. It's 517-594-4355. So you can give us a call and we're happy to help you as well. Here's our portal, and allows for you to again connect with us there. You can submit your required documentation through the portal. You can choose plan design there. We can add an optional benefits, so we're not going to get away. So once you have enrolled in your benefits, you're going to have employees that um, terminate, have a baby, all of these different kinds of things that you're going to need to have help and support to make those plan changes. We're going to be here behind the scenes all year long, helping you through that process and take care of your employees. And then we have a team that's specifically going to be there for managing the billing. And if you're subsidy eligible, making the appropriate subsidy adjustments on your bill. We're going to collect the premium that you owe from you, and we'll collect the premium from the state that is subsidy, and then we'll collect that and send that on to Blue Care Network. So Blue Care Network, behind the scenes, they have no idea who's subsidy eligible and who's not, but they're getting made whole on the back end to make sure that claims are paid. And then the other thing that I could use your help on is building this out so we're strategic and sustainable. So while this is a 2-year pilot, we want this to last for a very long time. And so we need to have one long-term planning, even if you're not subsidy eligible, but this is a good fit for you. We'd like to have your stability in the plan. We're going to continue to monitor and evaluate the effectiveness, making sure that we're watching turnover, that you feel like it's helping you attract employees. So we're going to be asking and checking in with you all year long. We also want to make sure that the benefits are meeting your needs and getting feedback from you. But also the important piece is a lot of you have community partners or maybe investors that that would be interested in your area or your community to donate towards the subsidy. We have a foundation that's set up that can take subsidy donations to help increase that $1.8 million. So if you have or know of anybody that might be interested, please let me know personally. That I have been taking the charge on trying to raise more funds so that we can offer this plan to as many people as possible. Now we're going to turn this over to the questions section, and my team's going to kind of help me if there's any questions that they haven't been able to answer in the Q&A, or if you want to add more questions that I didn't get to or you didn't feel like was clear, please go ahead and throw those in the Q&A section right now. Brianna and Kevin, are there any there that you need there that you haven't been able to answer or anything there? No? Okay. Looks like Kevin's answering Heidi, so we're all set there. Any other questions? Well, if you have questions as time gets closer, we're not going away. We're here. So when I said 100% participation, that was related to the life benefit, not the health. So if people are on Medicare or have other insurance, they can waive out, and that counts towards um um eligibility. But when I was talking about participation, that was specifically related to short-term disability and the life policy. When do we unmake the decision time-wise? We'll communicate that to you when we send this out, but December 22nd for a January 1 effective date is going to be like the D date. We're going to need everything completed by then, and all of your decisions and your employees' decisions in by December 22nd. So we're going to do our level best that as the attestation forms come in, that we're communicating as quickly as possible and who is subsidy eligible and who is not. And so that you can make quick, decisive decisions for your employees this open enrollment period. Will there be sessions that are directed to the child care providers, or is this the only opportunity to learn about this? I think we're gonna do some a little bit later after the November 15th to talk through the differences between subsidy and non-subsidy, how we're going to set you up in the portal and some of the technicalities of that. But um this is the I guess I would like to know what you're asking for in more detail if we're not hitting the mark in that space. If your spouse works 30 plus hours, they would be eligible regardless if they which shift they work. When you enroll, how long are you locked into the program? Can you drop the insurance at any time or wait for the year to end? You can terminate at any time, and you'll also be terminated if for non-payment as well, if payments are delinquent. But yeah, you can drop benefits at any time. Is all the benefits able to be signed up at any point of the year, medical, dental, and vision. So when you can't like roll for medical in January and then decide you want to add dental and vision in March, you do have to make that decision all at one time. If some employees decide they want to lower the deductible or higher premium insurance, they only get the 291 credit. Yes, that's correct. Good questions. Any more of them missing here? The 291 is for each employee, not each person. So if you're a two-person, you're still going to get the 291. If you and your husband both are employees, you could enroll as two singles and each receive the subsidy. Any other questions that I didn't answer? Thanks, Jamie. I'm glad that this was informative. You guys, it is really cool that we get to do this for you. I wish I had billions of dollars to subsidize all of it, but I don't. So the more I learn about your industry and what you do, it's just you're a gift to all of us. And so I really appreciate working with all of you. Um, the director of Great Start to Quality, and I was thinking of doing a session to get this out. Is that okay? Yes, you can share this with anybody when you get it. Feel free to share it with your networks. I also wanted to point out too, I know that there was a couple of Facebook groups that you all are part of that we're not. And I know that there was a lot of discussion about nurture benefits on a few of them, and there were some frustration that we weren't answering. We're not part of those chats or any of those things. We do have our own nurture benefits Facebook site. So if you have questions, that's the place to go there, or as I said, to the service site. So we are not childcare providers. We're not participating in any of those chats. And so if you have some questions about this, that's where you need to communicate with us. Also, we've had some questions. I just wanted to point out that some requests to have the Spanish versions of this. We will have all of our documents and presentations are currently being translated into Spanish and Arabic, so those will be available very soon. Our chat in our service portal, you can automatically in the upper right hand corner, if you need to communicate in Spanish or Arabic, that's already set up, and you can communicate with us in your native language should you need to. Is there a yearly max amount paid for dental? I'm not sure what that means. There's a premium. Oh, is there a max on the benefit? Yes, I believe it's $1,000. And again, all of the details on the benefits, I really encourage you to use the tools. There's a benefits at a glance that's super detailed on the dental too, that will like break all of that out if that happens to be something that you're really interested in. All right, I think that's a wrap, ladies and gentlemen. Thank you so much for your time. I know you're very busy. Take care, everyone.